Got a core group at the moment of 2 exercise physiologists. We are supported by 4 or 5 PhD students. We have other individuals who are more, who typically align and sit in some of our other research strands, also contributing to this area. So you've got, within our school, you've got Matt Smith, John Batten, Joe Beatty, etc. Some of the work that David Jessup and Chris Whittle would are looking to engage in, that would also tie in nicely, I'm sure, to the physical activity, health and wellbeing strand that we do. So we wanted to try and develop this critical mass of researchers, and we need to go beyond our current department and our current school. So hopefully there's going to be people who have been on this call and in other faculties, I guess, who would also want to hopefully buy into the work that we're trying to do. So how are we going to try and do this? So we want to create a critical mass. We want to obviously produce high quality, internationally excellent research, which ties in with our objective of how our research centre will ultimately underpin some of the research that will be put forward to REF 2029, so our research assessment for UOA 24, so our sport and exercise assessment. How are we going to do this? Well, we really need to increase our inter and multidisciplinary research within Winchester. Okay, so I think physiotherapy, psychology, potentially OT, etc. There's groups of or schools, departments who would feed in nicely, and I know that we're very open to collaborate with those groups, and hopefully people in those schools will also be willing to come and have a conversation with us. We also need to increase our collaboration with HHFT. There's pockets of really good work that's already been undertaken. Stroke, respiratory is probably the 2 strongest areas at the moment. I think biochemistry, through some of the conversations Scott and I have had in recently, is also an area. We've done some good work in the past through with the orthopaedic team, and I know people like Liam, in fact, are having conversations with the orthopaedic team, both at Winchester and at Basingstoke. James Belsey, who's been an early career research fellow with us, he's done some really good work around return to physical activity post-surgery, post-knee surgery. So there's lots of opportunities there as well that I think we just need to grow. One of the challenges I think we have with the Trust is that they're not too aware of what our expertise is, and we're not overly aware of where their research interests align. I will disseminate later today or tomorrow a recent newsletter that the Trust have created around some of their recent projects. So again, it might highlight some key people that people within our faculty or within the wider university might want to engage with. We also need to engage with local and national higher education institutions. So, you know, research institutions that may have equipment, facilities that perhaps we don't have here at Winchester, but we might be able to tap into to continue to engage with high quality research. It's also important that we as a university are more engaged with NIHR ARC Wessex. So this is the applied research collaboration in Wessex. It was one of 16 ARCs that were funded back in 2019. That funding period is due to come to an end in 2026, and the ARC are currently going through a process of gathering information and data as they apply for further funding. Last time, in 2019, they were awarded £9 million to support research across various different themes, from long-term conditions to healthy communities, to the NHS workforce, to ageing and dementia. And it's an area where I think we, as a faculty of health and wellbeing and as a university, really should be looking to get more members of staff involved and associated with the different projects and themes of research, because there will be opportunities, I imagine, for project grants, for PhD studentships, for other small pockets of money as well going forward. So strategically, it's important for us to be aligned with that. It's very Southampton dominant at the moment. Portsmouth and Bournemouth and Winchester are the contributors, and we are probably the smallest contributors, let's say, in terms of academic staff to NIHR ARC Wessex. So it's definitely an area we should be looking to grow. Also, with regards to industry funding, opportunities from a physiological, biomechanical perspective, whereby we engage with industry to hopefully undertake high quality research or KE type work, I guess, as well, that can be funded, might support MRes studentships, could support PhD studentships. These are the sort of things also that I think we as a collective need to be thinking about going forward.